Welcome to Help, I Have Kids. I'm your host, Pam Marshall, a mom of 5 and a pediatric occupational therapist with over 35 years experience. This podcast is designed to equip you with practical tools, insights from experts, and real-life stories. Because at the end of the day, you are the head of your child's care team. Each week, you'll hear from pediatric experts and fellow moms like you that will help build your confidence. They'll offer clarity and empower you to make informed decisions that work for your whole family. Hey moms, welcome back to Help, I Have Kids. If you have a cup of coffee in your hand and maybe listening to a baby monitor and taking care of babies, this episode is for you. We welcome our guest. This is Jenna. How are you, Jenna?
Well, thank you. Happy to be here.
I'm so glad you're here too. So Jenna is a certified pediatric sleep consultant. That's a big mouthful. What does a sleep consultant do?
Yeah, I work with families with children 0 to 5 to help to problem solve sleep issues that you might have, in the newborn phase and also infant and toddler and preschool age.
So you do this professionally. What is the name of your company? Tell us about that.
Malama Mama. I'm born and raised in Hawaii, and Malama is the Hawaiian word for care for and protect.
Oh, I love that.
When I created my company over 12 years ago, I thought, that was my desire for the families that I work with as a birth and postpartum doula as well. And sleep consultant is caring for and protecting families in their childbearing years.
I love that. Malama Mama. You can say that. It could be kind of like a tongue twister.
Yeah. Lots of alliteration.
Lots of it. I think that's great. So how in the world did you get into this? Because sleep training is sort of a very controversial subject, I'll tell you.
Yeah.
I know back many, many years ago, my oldest is 33 at the time I'm filming this. And, there wasn't a lot of information back then about sleep training, although it was starting to become a thing. Like people were starting to do it, but it was very still controversial as it is today.
Yeah. Well, I first, about 12 years ago, did my birth and postpartum doula training. So I kind of was in the birth world. And prior to that, my oldest is 15 and a half. And I, as a first-time mom, was the kind of mom that just read a bunch of books. I went to parenting classes. My children were both born in New Zealand, where my husband is from.
Oh, wow.
And so I had access to just different types of information and advice than the United States. So I just read a bunch, and my kids from an early age, I was just really into sleep. I have high sleep needs and sleep requirements, and we really focused and prioritized it in our household. And so I was that friend in the coffee groups, the mom groups, that everyone said, oh my gosh, Maya's sleeping in the room during, our get together, the play date. Like, how do we do this? And so when I became a birth and postpartum doula, I also realized, this is a profession. You could become a sleep consultant as well.
Well, there's a need for it because we're all sleep deprived as parents, and, people are craving it. They're just like, if I just go get some sleep.
And particularly in America when, maternity leave is 6 to 12 weeks. And the expectation in our society is that you have your baby and then you get back into it. You just go right ahead. So where in other cultures and anthropologically, when you might have your baby on your hip with you or in a carrier 24 hours a day, that's just not the reality in 2026. And so that was sort of the genesis of it. I kind of became a part of this world and then just added that to my professional tool belts. And so now I kind of work with the families from birth to postpartum and up to age 5 because it just made sense. And I love doing it.
Yeah, it does make a lot of sense. And there's so much pressure right now. I know for you moms listening, there's so much pressure that you do it all right. Like you have to breastfeed beautifully and make all that work. And you've got to, be organized and have these beautiful homes and know how to put your baby to bed and happy little family. I mean, there's just a lot of pressure.
So much pressure.
Yeah. And the reality is it does not go that way. a lot of times. Sometimes you're, haven't showered in days and you look a wreck and you're not sleeping and you're trying to take care of your other kids and a new baby and doing all these things and your house is a mess. And that's the reality of what it's really like.
But what moms get fed on Instagram and social media is the Instagram version, which is kind of put together and it needs to be this way. And so, I just like to empower moms. Like you have options. There's no right or wrong way to do this sleep thing. And it is controversial. It depends on, you get to choose. And
well, I think that's the beauty, moms, you listening, is you do get to choose. You get to read or listen to different options, and you get to feel what brings you peace in your heart, what feels like the right decision for your family. I know that, 4 out of our first 4 out of our 5 kids did not sleep as babies, and they wanted to nurse every hour and a half, 2 hours around the clock. And it's exhausting. You're almost crying because you're so sleep deprived. And, and in my book, I thought if a baby would sleep 6 hours, 7 hours, that's sleeping through the night in my book. I'm like, if I could get 6 hours, I would
life-changing.
be life-changing. I'd be fine. But, we can't make our babies do. There's nothing I did any different with the 5th one. He just decided to sleep through the night at 7 weeks. There's nothing I did to make that happen. So you moms, I think I just want to encourage you that listen today, see what we're talking about, and you decide, is it right for you or is it not? Or it may be right for a friend. Maybe you have a friend that's going through a hard time with a baby. So let's get into it. What is sleep training and what do moms need to know about it?
Yeah. Well, okay. The term sleep training, and we kind of use that to be a little controversial. I define the term sleep training in the AAP, American Academy of Pediatricians, define sleep training from when an infant is 4 months and above. I use the term sleep conditioning. So those families of newborns, sleep shaping or sleep conditioning from 0 to 16 weeks. There's a lot that we can focus on in the first 4 months of a newborn's life to prioritize sleep, but there's some really important things to be aware of in that first 4 months of a baby's life. They're so little. Their brains are developing, and they need that attachment. They need that response. So how we treat, how you parent in the first 4 months is different to then what you have available to you from 4 months and above. So when Pam and I are using the term sleep training, just know that that's for 4 months and above, because that is the recommendation of AAP.
And it's funny that I didn't know that when 33 years ago when I had my child, but I just knew instinctively because I knew development. I knew that before 4 months, babies cry because they have a need. They need to be fed, or they are gassy, or they need to have a bowel movement, or there's a reason. There's a reason. And they need that comfort and that closeness and that responsiveness to their cry. And sometimes they're fussy, and they're just fussy babies. I mean, neurologically, there's lots of babies. I worked in the NICU that cried 24 hours a day, nonstop.
They need
almost.
more of that regulation.
They do.
From adults.
They need the help with regulation. But so instinctively, I knew it was 4 months and above. But another important thing about it is all families have different schedules, different lifestyles. Some people work night shifts, some people work day shifts, some people, there's different rhythms, and we have to be mindful of that our baby's coming into our world, our system, our rhythm. And I would talk a lot to young moms about day-night cycling. Like if they were a family that were on a daytime schedule and sleeping at night, making sure you're low and slow and quiet in the dark, that you're not spending extra time talking to them and interacting with them. You're pretty much responding like, this is sleep time. I'm not talking to you. I'll, feed you, change your diaper.
Business only.
Business only. Go back to bed. And you do that early on as a newborn.
Yes.
And you don't sit up and turn lights on and read a book and have music playing. And, you keep the stimulation very low and slow.
Absolutely.
And we used to do that in the nursery, in the NICU as well. We would do day-night cycling. Yeah. Just so the least amount of stimulation at night.
Yeah. And then the newborn phase, the way a newborn's brain works in the first 6 weeks of a newborn's life is they're still establishing their circadian rhythm, and hormones from milk, the light, the sunlight and everything is all contributing to that circadian rhythm development. So we don't see that circadian rhythm established. So you'll hear the phrase, "Oh, the baby has their days and nights mixed up," because, "Oh, my baby wants to party from 12 to 3. And that's can happen and is more normal in the first 6 weeks because of that.
And don't you want to ask that mom, what was your life like being pregnant? Because sometimes you find out, well, I like to stay up till 2 a.m. and do whatever. And my husband's sleeping. And I'm like, well, and you wonder why your baby's
that transfer does happen. Yeah. And then from 6 weeks is when they start to establish, that circadian rhythm is established. But really you're in that sort of newborn. And that's another reason why we can talk about sleep training from 4 months, is because newborn sleep cycles are still establishing and developing from 6 to 16 weeks. So we don't even see a more adult-like sleep cycles in an infant until 4 months, and that's why we focus on kind of conditioning and shaping in the first 4 weeks, and then we can kind of have those higher expectations from 4 months. They have more capability is established at that time.
Right.
So, yeah. But you're right. One of the first things I do when I'm working in a client's home is if they have lights on everywhere, I start turning lights off and dimming, and I might turn the TV off because, if it's a very high stimulation environment, the brain is going to be stimulated.
And there are homes who do have TVs on 24/7 or music or noise going all the time because maybe a person grew up that way but learning how to maybe shut some of that down for your newborn is really, really helpful, because people just don't think about how a baby they're not able to handle 4 or 5 types of stimulation at once. And you really have to, I just always call it low and slow.
That's right.
Just be low and slow.
So good.
And simple. Yeah. And what, there are also different belief systems, like some cultures, and in our culture, I feel like we have everything because we're a melting pot of people, but some people want to be baby wearers and want their baby close all the time, except for maybe when they're sleeping. So how do you work with different cultures or different expectations?
Yeah, that's a really great point. And I love that. And our children were born in another country, so I got different sleep advice and guidelines. We are in America, and so most of you listening are most likely going to be getting advice from your pediatrician, which follows a set of guidelines on where your baby should sleep. However, you might have a friend that is from a different culture that bed shares. A lot of Asian cultures will bed share where baby is in the same sleep surface. A lot of Pacific Island cultures and things will have a little sidecar, kind of thing right in the bed. And so it's not necessarily wrong. They're just different guidelines and safety expectations that go along with that. So the way I practice as a sleep consultant, and this is my evolution over a decade of doing this work. In the beginning, I was very mindful of sticking to AAP guidelines. You're going to sleep on a firm, flat surface on your own separately all the time,
and on your back.
Your back. Yeah. That's the only way.
Which babies, honestly, dislike their back. They're not developmentally
right.
They really want to be like a room.
Yes,
they want to be all tucked up.
Yeah. But as I've evolved, now I work across the spectrum and the range of sleep approaches, and I'm very comfortable operating in that space. So I draw upon best practice guidelines from the different La Leisha League and the American Academy of Breastfeeding physicians and things like that to look at safe sleep depending on what the family wants. Some families will come to me and say, I want to hold my baby. I want to do contact naps. And it's like, okay, well, let's look at that. And it's my job to provide solutions for safety, because I do know that contact naps can be unsafe, depending on if you're falling asleep on a couch in a recliner and you're not mindful of where baby can land, just different things like that. So looking at what are your goals, what resonates with you as a parent, and then coming up with a solution and a plan with safety at the forefront that will work for you. So I've definitely widened my practice and realized that there's no right or wrong way. One family, and some people really want to follow AAP guidelines, and I think that's great. And I will work with families to achieve sleep within those parameters. But just know that, if you're wanting to wear baby, that can be really great. It's a really great, babies want to be there, especially in the first 4 months. So getting together with a baby wearing educator, a lot of them will check in your local area. They'll have libraries of different carriers because you do need to learn how to safely baby wear. And that can be a really great way to do hands-free and to get baby to sleep on the go, especially if it's a second, third, fourth baby and you need to be out and about and baby needs to sleep, but
I really love the wraps, the stretchy. I mean, they are so great. And that's an art to learn how to wrap them up. Again, we didn't have those years ago.
I still have to YouTube depending on, which carrier I'm using.
Yeah, there is a strategy behind how to do it. But it is neat how comfortable you can get them and them on you. And especially even if you have a big baby. Like I feel like you can manage it with a big baby. Yeah. Well, and developmentally, there gets to be a point where babies need to sleep great to be able to grow for their brain growth and their development. So let's talk about that. Like, what might be some motivators besides the parents wanting sleep, besides we mamas need sleep, and especially if we have other children. Those other kids are getting up, like you can't sleep in if this is not your first baby who's having trouble sleeping, and you've got other little ones to take care of. What would be some other motivators? Like, what would help a mom decide, okay, at 4 months, I'm going to look into getting some help or using some strategy?
That's a great question. When I work with families, and this is a really great, if you're hearing this for the first time, I use the guidelines, the recommended sleep guidelines that we have in this country, and they're pretty global. And one thing I always like to bring to parents' attention is the range in recommended total cumulative sleep in a 24-hour period. It's usually a 3-hour range. So for a newborn, it's, like 12 to 13 or 14 to 16 hours in a 24-hour day. For older infants, it, goes from 13 to 15 hours and then 12 to 14. Usually it's a 3-hour range. And so acknowledging the fact that first of all, just acknowledge that your child might be on the higher end of sleep needs. There's some babies that just have high sleep requirements. My oldest, absolutely. She slept even more than the recommended.
And especially when they're going through those growth spurts. When they're in a growth spurt, you can tell they're hungry and they need to sleep.
Just want to be little sleepy heads. And then some babies are just on the lower end. So this is where that comparison can be really hard, because in your same coffee group or mom group, you could have a 5-month-old that sleeps, 16 hours a day and a 5-month-old that sleeps 13 hours a day. And that's hard. Because the 13-hour mom might say, oh no, what's wrong with my kid? They're at a sleep deficit. You're not necessarily at a deficit yet. Your child might just be on the lower end of sleep needs, or maybe they do need help. And usually I can get a little more hours out of when we do sleep train at that age. If your child is kind of I do get phone calls from parents and say, my 3-month-old was just up for 6 hours straight. That's a problem. Newborns
shouldn't be.
Can't and shouldn't be up. A 3-month-old baby should not be up for 6 hours straight. Their brain needs, we need to establish. And that's when I'm like, okay, there's a pathology here. There's a problem that we need to fix. And so I first like to say, okay, is there even a problem? Because I think with anxiety, when you read, oh, my child should be sleeping 16 hours, it's not necessarily true. Some 5-month-olds just need less. So first we establish whether or not there's even an issue. And then from there, Yeah. We have, once your child is 4 months old, we have so many options. We have the whole range of sleep approaches. And I like to tell parents it's everything from, in some cultures and approaches, we have from bed sharing all the way up to more traditional sleep training, independent self-settling methods, and then everything in between. There's so many different ranges depending on what resonates.
Whether you use a pacifier or not, or just all different things. It's crazy. One simple thing we learned to do was once they were able to sit up and safely drink, babies get thirsty like we do. And we would just keep water, a sippy cup of water in the same corner of the crib.
And they can just
take it. It was the best strategy. And most people don't think about that.
Yeah, you're right. Because I tell them and they're like, I can do that. Or, even a bottle if they're worried about it. And now we have sippy cups that don't spill. But,
And just a sippy cup of water.
They don't need milk.
Sometimes it's magical. They just want a little quick sip.
Yep.
And they get back to sleep. It's a great tool. And, that was the case from, I'd say, about 6-7 months when they were really able to sit up and get over to that cup and take a drink. Till they were probably 3 or 4, they would keep it there because we had one of those cribs that converted. I think we had our crib up like 15 years. It was really crazy.
Yeah.
I don't know.
For all the kids.
A long time. It was and there was a destroying of it when it was over. That was quite a thing.
Crib.
The oldest and the youngest, I mean, they smashed it because it was not good anymore. Like we had it glued together, basically.
But it served your family well.
It did.
Yeah. But I think so developmentally, if there is an issue and you are finding that, the sleep thing isn't happening naturally. We came out of the newborn phase. We're at sort of 5 months. We went through the 4-month sleep progression. Yeah. We're all really tired and we're having broken sleep consistently. That's when you have options available to you as a family. And, you just know that it's at your comfort level at this age. You can use, I know that we use Dr. Richard Ferber's name as a dirty word in some circles, but really the Ferber method, it actually is one of the most responsive, independent, self-settling tools. I like to educate.
Can you just explain that briefly? Just give a little overview for our moms so they know what that is.
It's also known as check and console. It's where we are responding. Baby is being allowed and given the space to make noise, cry, and we are making sure that the foundation is set, all of the sleep environment is optimized, and we're giving baby this space and then checking in at certain intervals. And you can find Dr. Richard Ferber does actually have in his book, a chart that has guidelines on when to go and do a drive-by. So you might be coming in and putting your hand on baby's chest. You might be replacing a passy. You might be turning on a shusher. You might be just holding space for a baby. I don't recommend talking to baby because talking and singing can be stimulating. And typically I do recommend white noise too. And so maybe they're not hearing you as much, but it's just a reassurance just to make sure, baby, you're not being left alone and we're here. So it is a really responsive, self-settling tool. And I know it can have a bad reputation, but it's one of the most common sleep approaches that I utilize with my clients because it is very responsive. And so once I educate parents on what it actually is, usually that's the one that they say, we want that one. Instead of, extinction is true cry it out, where you are saying, good night, baby, at 7 p.m. I'm not going to see you at 7. This is emergency. It is evidence-based. It's in the empirical research. It has been studied. It's technically safe, depending on how you want to interpret the research. I just personally don't ever need to utilize it just because.
Oh, there's no way I could have done that.
And I'll never tell a parent, don't go and check in. Because, I always like to say, but I do empower parents. We go through our checklist. I want you to know that it's not hunger. If their arm is through the slats, you're going to listen to the cry. You're going to notice if there's a pain cry. I want you to go and check if baby's pooped. I don't want you to leave baby in there poopy nappy or diaper, all night long. So you go in and you make sure that all of baby's needs are met, so that when you are letting baby self-settle during that process, you're confident. They're just complaining. These are complaints. And I also do a lot of education with families around around crying and what that means for your infant. Once all of their needs are met, I do a lot of emotional regulation with parents, of course, around...
most of this stuff is our problem, moms. Most of it's us. I mean, I know I could, when we decided to do sleep training and we did the method of going in and reassuring, doing that little touch and going back out and coming in at the intervals. But I couldn't do it.
Yeah.
Like,
it's hard.
Moms, if you're like me, I couldn't do it. It had to be my husband. There was no way I was going to be okay walking out the door with our 4-month-old crying. I mean, all of them. Yeah. He did it. He committed to do it for the first, and literally everyone, it took 3 nights.
Yeah.
And by the 4th night, they were done.
Yeah. These methods, and that is why a lot of parents do choose to use independent self-settling methods, because it's 3 to 5 days.
It's really quick. And I've told parents that over the years. It's hard to believe it when you're on the side where you're exhausted and you've been doing it. Yeah. It's hard to believe it's that quick, but I promise you it's that quick. I did it 4 times that quick.
Yeah. So just a reminder, the emotional regulation piece is it's allowing, your baby is allowed to cry. So they're complaints, so children, your son and your daughter are allowed to be upset. They're allowed to be bummed out. They're allowed to be disappointed, and they're certainly allowed to express their anger. When your toddler is learning to walk, you don't go and pick them up every time. You encourage them from a distance. You reassure them. You tell them, you've got this. I love you so much.
You let them fall.
Yeah.
You let them fall.
Yeah, but you don't get out of... Yeah. We're not going to rescue you from learning to walk. Yeah. And sleep is one of it. We're biologically born with, our body is made to sleep, but it is a skill that we do have to prioritize, and we do have to develop. Our brain, we're born with no ability, we can cry and poop and eat, but sleep is one of the first skills that our brains do learn to connect those neural pathways. And so we do shape how a newborn perceives and experiences sleep. So it's either a household that shapes and prioritizes sleep, and we talked about the environment and how much that really does impact, or it's a house that teaches a baby to be rescued and respond, which is not a problem. But babies will definitely, in those first 4 months, you're either going to shape whether you're letting them kind of learn more independent sleep, or whether you're teaching them to be a signaler.
And there's routines.
So important.
Some people are routine people and some people are not. And if you're a mom who's not, I wasn't a routine person, but I started getting more routine as I understood it was good for my baby or good for our kids.
That's how their brains are
wired. Routine is important. Setting bedtimes, following bedtime routines, even when they're 4 months old.
From when they're newborn.
You follow a routine and if you have to, sometimes I would write it out. So it would help me follow it.
I recommend you print it out. And it doesn't have to be elaborate, but the research does show that just those same steps. It just helps because newborns and infants, their brains are just, because they're not developed, they need that predictability. So they thrive on that predictability. So yes, spontaneous, go with the flow. Moms and dads, parents, that is one of the things that I...
And we actually should be doing it as adults, too. I mean,
for our sleep hygiene,
we should have sleep routines. It's so bad. I'm the kind of person that when I stop in the evening, so if I sit down on the couch and my husband's watching TV and I join him, I don't watch TV. I just go to sleep. And it's very bad for me to do that. So I have to learn that, I've got to sit in a position where I'm not going to fall asleep, because it's better for me that as I'm getting tired to just excuse myself and do my sleep routine and go ahead and get in bed, because
it's true.
It's a mess when you fall asleep on the couch and you're sleeping for 45 minutes or an hour and then you get up. That's not good.
And Americans as a society, we do have chronic sleep issues. The amount of people that go to their doctors and get prescribed sleeping medication or routinely take tools like melatonin. So as a culture and a society, we are notoriously bad at prioritizing sleep. And we see a lot of the autoimmune and hormone disruptions that come with that. And so when you're bringing a baby into your family, a child into the world, that's one thing that I always ask parents, especially I love working with pregnant parents, because I can kind of talk to them about, what does your sleep hygiene look like? What is your your habits, because sleep has to be a priority if you want it to be a priority. It takes a lot of intention. That whole adage, fail to plan, plan to fail. If you don't have a sleep plan in place, if you're winging it, sleep isn't going to happen as intentionally as it might in those first 4 months. So there's a lot that can go into those first 4 months.
So much. Yeah, and first-time mamas have to think about that, and you've got to think about your own sleep routines. I highly recommend shutting your phone down. We have a 7 p.m. shutdown because screens are another thing. And over the years, as a pediatric occupational therapist, I've went into a lot of different homes and seen a lot of different things. And I think, not judging it, but I think it's very, very hard for those families that choose to put a TV in their infant's room. I have seen cribs.
I've never seen that.
Oh, yes, I have seen it.
Okay.
Where there's a crib, and across from the crib on that wall is a TV.
Oh,
and so they've mounted a TV in an infant's room. And I disagree with that. I think it's terrible for brain development and sleep and all those things. Yep. But again, those are families that maybe as adults, they do it. They keep the TV on because they grew up that way or whatever.
Yeah, that makes sense.
But the challenging thing is that best. You have to decide, is that best?
Yeah.
Are your habits the best for your baby? Yeah. And I think that family probably just put that TV on the wall because they do it, thinking, oh, their baby needs that too. Yeah. But we really have to think about our own habits and how it's impacting our children.
Yeah, absolutely.
So older kids, let's talk about that a little bit.
Yeah.
So we've been talking a lot about babies and that 4-month-old, that's, critical time. But maybe some moms listening, maybe they have a 1-year-old, an 18-month-old. Maybe they didn't know to look into sleep training. And now there's some bad habits. Or we might have some moms, if you're like me, we made some mistakes. Like we got into some routines that were not good. I remember we had one that demanded 100 pats before they went to sleep. You know what it's like to count out 100 pats? Like that's a bad mistake to get in that habit. Yeah. So what are, these families that you're helping that maybe they made some mistakes and they have some bad habits going, and how do you break that?
Yeah, I get a lot of calls from 3-year-old parents. I love working with 3-year-olds because the nice thing with older toddlers, preschoolers, is that we don't see rational thought being developed until 2.5, 3. Mm-hmm. So the fun thing with, because 1-year-olds and 2-year-olds, you're still operating in that funnel of their ability, you're responding to their neurological development. 3-year-olds, you can have a conversation with them. And so I actually love working with 3-year-olds.
So
and, we get to use more tools. So the tool belt is much wider. So I get to sit down with parents when I'm working with them. And, you can utilize, I talked with parents about what is your child's currency? What is your child's love language? And what is, what makes them tick? What motivates them? Because at this stage, you're learning about your tiny human and you're realizing, okay, like maybe it's quality time. Maybe they'll be motivated by this. So we can start to incorporate, not necessarily a reward chart, but the concept of that. And we can utilize different strategies because most 3-year-olds are in toddler beds or separate beds. They're usually graduating
and
from
those
the crib.
Busy little ones that can't shut their brains down. Usually the really bright ones, they don't care what negative consequence. They're going to get up out of that bed and try to get your attention no matter what.
So so it's really fun. I personally love, and I do work. 3, I think, must be a breaking point for a lot of parents because I do work with a lot of 3-year-olds. And, so just know that there are tools and you can do a lot of research. So if you're DIYing it, you can read more about, toddler approaches, but sometimes we create the boundary in the bedroom. Sometimes we do, kind of a silent redirect. We talk it through and we create a strategy. That way there's really cute strategies for 3-year-olds. Some people will do kind of like a love cord where you hold it and you do tugs and things and some people will just sit and do the chair method. But anyway, there's so many different approaches for sleep that you can Google, and now you can ask AI and things like that to come up with. And then the main part of it, and the reason why families will often work with sleep consultants, is that implementation part. So it's just, walking through it and being patient and, kind of sticking with whatever boundary and whichever approach that you're going with. But yeah, I work with up to age 5 because typically up to age 5, it's usually just them testing boundaries. Once a child starts to if a child continues to have sleep challenges past age 5, that's when I know it's beyond my scope of practice as a sleep consultant. And we do need to start making referrals to, allied health professionals or your pediatrician, because there's potentially something neurological or clinical going on. And, and there are, of course, with younger littles as well. So I'm always first to, as part of when I'm diving in, I'm always asking, okay, well, is there something here that we need to refer out for? If it's outside of the scope of kind of typical infant, toddler, preschool sleep. And so, but up until age 5, usually it's just kind of boundaries and strategies that will work with their brain, and creating so much of sleep for both adults and little people is setting up the right environment. So I'll get a lot of calls from families across the country, and they'll say, oh, we tried that method. And I'll sit down with them. I'll do my questionnaire and I'll sit down with them for their consultation. And I'll say, well, tell me what you did. And they'll tell me. I said, okay, that's not that method. Or you didn't do it for the 12 weeks that method requires, and as a responsive method. And so, okay. So it's really
there is a commitment to what you're choosing to do. Yeah, that makes sense. Yeah. And a lot of parents don't realize the type of sensory stimulation a young child will get before bedtime is really important too. Yeah. Why that, those routines of like dinner and a walk and, whatever those are, and keeping them from, I think I talked about this in another podcast, but at night, right before bedtime, a lot of kids want to jump. They start acting like a kangaroo and they're just bouncing and jumping up and down. And the reason they do that, which is kind of wild, is it's very stimulating, like a cup of coffee. If you start doing it, you'll realize, like trampolines. So you families that have trampolines, do not let your young toddlers with sleep problems go jump on a trampoline. That is wrong. Do that earlier in the day, before dinner. Very early in the day. Don't do it before the couple hours before, because it is the most stimulating. That vertical vestibular is the most stimulating input to a brain, and it makes them stay awake like as if they have a cup of coffee. You want linear. That's why swinging in a straightforward backward is the motion of calming, or it's why instinctively with babies, we sway side to side, or we do linear movements.
Reading books, laying down.
Right. Sticking to the linear one way, never spinning, rotating on a swing or a chair or something like that, and no vertical. And so those are things that sometimes parents don't know.
Well, how would you know?
Right.
We don't get a manual for this. And so we just get...
also, I think most moms now should be aware of sugar and the effects of caffeine and,
nutrition is such a foundational
red dye
part.
And all of those, and removing all that kind of stuff from your child's diet is also really important.
Yeah. Nutrition is kind of the premise for myself as a sleep consultant, starting from newborn phase nutrition. So that starting with milk is kind of the core of my work that I do with families.
Sometimes you find that there's something that's
and a lot of families don't even think, oh, that fruit has natural sugar. And they're like, oh, he has 4 bananas, at 4 p.m. I'm like, okay, so we have to make some adjustments there.
Right.
So no, it's so older kids, absolutely, we can look at their sleep needs too, and that matters. And so there's definitely solutions for older kids as well. It's certainly not just an infant problem. Yeah.
So it sounds like you really tailor the plan to the family and the age of the child. Also what they may have tried, may not have tried. And then regression. Do you get families that call you because maybe they implemented something, their kid was doing great, and then all of a sudden there's regression?
Yeah, absolutely. So sleep in general is just not linear. So the 4 major regressions for 0, the child's first year and a half is around 4 months. You get the 4-month sleep regression progression, as I like to call them. And that's when they're coming out of that newborn phase and they're establishing more adult sleep cycles. And then we see another one at 8 to 9 months. So I work with a lot of 9-month-olds. And that is because it's kind of separation anxiety is kicking in. You're definitely getting crawling happening, sitting up more. And then 9 months is sort of there's a lot of brain development because we're seeing pre-object permanence. And that's when a newborn or an infant's brain now has the ability, because of those neuropathways, to know that something that they can't see
still exists.
Yeah. Before that, they don't know.
So that means you moms, when you walk out the door, they know you're on the other side of the door.
And that's why sleep training parents will ask, when's the best time? I'm like, usually like 6 months is because they don't know. And so they don't have that heartbreak, when you leave them that they do at 10 months. Yeah. And then we see another one around.
And it is a heartbreak.
Oh, yeah.
It's separation anxiety. I would always help the mamas at church because they would drop their kids out, because sometimes they were moms that didn't separate, maybe they didn't work or maybe... it's just a new separation. And
that attachment is real. And we want that real attachment, which is really important. But then we see 12 months is another regression time. And that's because you're getting lots of standing and things. You start to see a lot of nap protests. And then the last one is around 18 months. And that's kind of like that last hurrah. And so
that's when they like to push the buttons and need the first real discipline happening. Yeah. All of a sudden, if you're new parents, you're going, what do we do?
Positive reinforcement doesn't work as much anymore. Yeah. And so, typically I can work through all of those regressions. And typically, I work with parents at any age whenever they call and have issues. I like to tell families, sleep is never an issue unless it's an issue. Yeah. Don't tell anybody that your child has a sleep issue. If you're fine with it, great. If it's working for you and your child is in those kind of guidelines, just check out the recommended guidelines for each age and stage. And if you're comfortable in that 3-hour variation and there isn't a deficit and your child is meeting all those milestones, go forth with confidence. There's no issue here. I am never the one to say there's an issue. However,
I do think a lot of moms don't know how much sleep children are supposed to get, nor do they really understand the portions of food. So those are two things that sometimes they need education
get some advice on.
Because
agreed.
I do think there are some kids that are older, like even elementary school sleep deprived, middle school, high school.
Agreed.
They're not getting the recommended sleep that they actually need.
I absolutely agree, because I work with those families and I see them. So you do need to be a household that prioritizes sleep. But I think it's...
So how does a mom get a hold of you? Because I think this has been so fascinating today. And I bet there are moms out there going, wait a minute, I need your help.
I need help. And again, it's you can DIY this, but when you're a tired, overwhelmed parent and you're just wanting to cut through all of the information, because there's a lot on Instagram and TikTok and all the things, hiring a sleep consultant. People invest in a sleep consultant just like you would invest in a personal trainer. It's just easier. And so if you value, kind of that focused effort and attention and someone to provide gentle accountability and to walk alongside you as you implement your sleep plan, that's why. And so my company is called Malama Mama. So it's just malamamama.com. And I'm Jenna Clark, and here in Lexington, Kentucky, but I work with families, from honestly globally. I work with international clients as well, but all across the nation. And I go in home, but I have limited capacity for that. So I usually am working with families virtually. So we meet, I have a questionnaire, we meet, I give you the space and I facilitate a conversation between parents to really think about, what is your sleep philosophy? What do you want this to look like? What are your goals? Because most tired parents haven't even stopped to think about what they believe. And dad and mom might have, two parents might have different opposing views on what their priorities are and what their goals are. And it's my job to give you that space on our video call. And I assess the room and the sleep space and look at your house and make recommendations and then write up a tailored plan, because it needs to be your plan. You can buy sleep plans for $100 on the internet, or even ChatGPT will probably write them now, but it doesn't take into account your family's unique values, philosophies, approaches, tools that you might be comfortable with and that you might not be. And so that's the value of a sleep consultant.
And sometimes you just need someone cheering you on and helping you know what's the next right thing to do.
What's normal, what's not normal. You know, yeah, exactly.
Well, I just appreciate all your knowledge and coming and sharing it with us today. And moms, if you need some help, call Jenna Clark.
Thank you.
Thank you so much for being here.
Of course.
Thanks so much for listening to Help, I Have Kids. If you're tuning into this podcast, that means you're a mom who's curious, committed, and ready to learn. And we see you. We'd love for you to join our Help, I Have Kids Facebook community, where moms just like you are connecting, asking questions, and encouraging each other every day. It's a space for real conversations, expert insight, and support from moms who get it, because we're all in this together. And if you know a mom who's feeling unsure or maybe overwhelmed, or just needs to be reminded that she can do it, she can advocate for her child with confidence, share this episode with her. We're building a village here, and we're glad you're a part of it.